Good morning, everybody, and welcome to the Straumann Arena of Confidence. My name is Francesca, and I'll be hosting today's session with Dr. Sam Dyer on digital ecosystem and how they're changing your practice right now. So welcome, Dr. Dyer.
Thank you for having me. I appreciate it.
Thank you for being with us once again.
Okay.
And once again, before we dive deep into the topic, I'd like you, if you could tell us a little bit about yourself, also to the audience at home.
For sure. I live and I practice in Vancouver. I got two practices in Vancouver. One of my practices is limited to aligner treatment only. My office is paperless, so we use it. It's a digital system all around in my office. So it's something that I hold dear and close to my heart. I've treated a little less than 6,000 patients with aligners. So I use a digital flow to help me manage my patients and manage the practices very well. I enjoy what I do. I travel a lot. I lecture a lot. And I get to see God's creation. So I'm lucky to be here. Thank you all for having me.
Thank you. Sounds all very exciting.
Thank you.
And today you want to share with us about the digital ecosystem and how it's changing dentistry. So could you tell us a little bit about, first of all, how do we define a digital ecosystem?
Okay, well, the digital ecosystem, it's a notion that is relatively new, but it's something that has become extremely important in any medical and dental office. So if you want to go through the definition, at its highest level in an overview, a digital ecosystem is basically made up of companies, people, data, processes, and things that are connected by the shared use of digital platforms. So having a digital platform to be able to connect and interact. So these partnering ecosystems are created to enable collaboration and provide mutually beneficial results to all parties, meaning basically the patient, the doctor, and the companies that are involved as well, because these companies are partners as well. So the idea is to create a collection of flexible services that can shift around and quickly be adapted to the ever-changing needs of a business and the medical and the dental world as well. So it really is, what this allows us to do is it will allow us to communicate a lot more efficiently on a basic level.
Absolutely, great.
Yeah.
And do you think a true digital ecosystem is really possible and beneficial? You mentioned a little bit about the benefits already.
Well, absolutely. It is beneficial, and it will only get better with time. So it does exist. We just have to work on putting it together. We have to connect all the different pieces so they all interact like body parts, basically.
Yeah.
As a whole, it's a body, but all these systems individually, they work like organs. So we can put them together, they will work very well, and it will allow interaction. And like, again, we keep going back to the patient. Ultimately, the patient benefits from this. So is it possible? Absolutely. Should it be available and should it be used by every practicing dentist and physician? Absolutely, yes. In this day and age, it's a must.
Great. And again, back a little bit to the benefits. Could you be more specific and concrete to what the benefits are for both patients and doctors?
Yes. So this digital ecosystem allows the patients to be mobile. Nowadays, we live in a world where the world is small. Traveling has become a lot easier. So we have patients that travel a lot, either for business or for pleasure or whatever the reason may be. They will always keep in contact with their doctors because of the system. So the doctor, not only can they have direct interaction with the patient, but they can also have direct access to the records as well. So you can have a full medical dental interaction with the patient no matter where the doctor is, no matter where the patient is, and no matter where the dental records or the medical records are. So that's what brings them all together. So the benefits you can imagine, in case of an emergency, in case of a quick question, the doctor can always interact with the patient directly, no matter where they are in the world, no matter what time zone they're in. So the benefit to the patient is absolutely, in medical cases, can be even life-saving, as a matter of fact, of course. And for the doctor, they'll feel better knowing that when they need to interact with their patient, there is a way of communicating with them, just to stay from a dental point of view, to stay on track, make sure that things are going well. Because sometimes if you allow things to lapse too long and the doctor cannot interact with the patient, then it might be a little too late and the doctors need to retrace their step. With the digital ecosystem, you can stay on top of it. And like I said, everybody ends up benefiting at the end of the day.
Fantastic. And after this introduction to the digital ecosystem, could you walk us through the different components that build up this system?
Of course. So it's important to understand that each ecosystem might be slightly different. The general points are always the same, but they vary from office to office. They vary from specialty to specialty. So what I tried to put together today are some of the ideas. Aligners, obviously, because of 3D printing, computer system, be it software and hardware, mobile technology, like we said, doctors are mobile, patients are mobile, 3D printing, the internet. Obviously, none of this would have been feasible without the internet. Cone beam, 3D radiology, intraoral scanning, artificial intelligence software, smile digitization. So if you look at this picture right here, this gives you a general idea of what all these components are together. So it allows us to literally hold the world in our hand and communicate with our patients. So if you look at it in a general system, these are some of the major components. It's important to keep in mind these are not the only component, but for my office, for an orthodontic office, these are probably some of the major components that we need to look at. So if we look at them individually, computers and internet, none of this digital technology will be possible without this. Neil Armstrong in 2000, in February in Washington, D.C., came up with the 20 most important inventions of the 20th century. And computers and internet and 3D printing were one of the three of the most important invention of the 20th century. So you can important how much this changed our life. And in order for these 20 inventions to fit on that category by Neil Armstrong, they had to have changed our lives drastically. So, so when we're talking about computers, when we're talking about internet, when we're talking about plastics and 3D printing, they certainly changed our life on a grandiose level. So none of this would be available to us without computers and without the internet. So this will probably be in any digital overflow, in any digital system, medical, dental, or even business. These two components are always common, and they have to be there, and they have to be functioning well. Now, in medical and dental field, when we're looking at 3D radiology, especially for us orthodontists and dentists in general, this has become crucial, and certainly to the patient's benefit. So when we're looking at treating patients, and if there's an impacted tooth, a tooth that is underneath the gum, an impacted canine, or an impacted wisdom tooth, there's no way for us to see the exact position with a two-dimensional film. So what we need to do is we need to go behind it, so to speak, and have this three-dimensional model, because depending on the exact position of each tooth, then our treatment plan will vary. So if that canine or if that eye tooth is close to the lateral incisor and we start pulling on it without knowing its exact position, we can damage both the canine and the lateral incisor. So it becomes harmful to the patient, almost not using three-dimensional or cone beam radiology in this day and age. So it will allow us to treatment plan our case differently, because if that canine is placed too buccal or too lingual, believe it or not, the treatment plan can be completely different.
Drastically different.
The treatment time can vary by 6 months, which is a long time. So having 3D technology, radiology, should be the standard of care at this point. And if we don't have it, then we're missing out on having the ideal treatment plan for the patient. So there's no getting around it. This is something that we should all be using. It doesn't mean we need to use it every time. There are times where you can see the roots and the teeth on a two-dimensional film. If we're checking something quickly, if nothing is out of the ordinary, a two-dimensional film can do. But most of these cone beam technology and X-ray machines can also give you a two-dimensional film.
Right.
The difference between 2D and 3D from a patient point of view is there's a little bit less radiation in a 2D film. But nowadays, most cone beam allow us to do a two-dimensional, just regular film. But it certainly is beneficial and important to the patient. Now next, let's go into the intraoral scanners. Now whether this is for orthodontics or general dentistry, that has become crucial on many different levels. One of the first things that, one of the main benefits is that it saves time.
Yep.
It's a lot more comfortable for the patient. So we've all seen these comedy skits whereby the dentist goes in and puts an impression and the patient is gagging on it and what have you. And you can see the humor and the comedy in that. But in reality, it happens often enough, right? So if you have a patient that is a gagger or whatever, there's too much material that goes down their throat, that's uncomfortable. That's, as a matter of fact, that's dangerous. So this is a lot more comfortable for the patient. You have to keep in mind that dentistry has come a long way in the last 50 years, but there's still a little bit of apprehension when our patients come and see us. When they walk into that dental office, there's still a bit of apprehension.
Yes.
So if we can make their life a little bit easier, then be it. It's upon us to make their life a bit easier. So a scanner will be a lot easier. And you can also take a break. A scan takes 2 minutes to scan the whole arch, right? So you can easily take a little break. If the patient's mouth is tired, you can take a break. It will also save time and space. So you have to think of the impression, a regular old-fashioned impression, the material, the impression material, the boxes where you're going to store everything. That takes up quite a bit of room in a dental office. Now, when you get a machine like this, which is a compact, which is basically a wand and a laptop, now you can fit it anywhere. You can move it from chair to chair. So there is one of the other benefits as well. But to me, probably one of the biggest advantages is that it's a lot more accurate.
Right.
So when we're doing crown or bridge, when we're fitting a crown, when we're doing aligners and we're trying to get every definition so the aligner fits well, now this gives us much better results. So the aligner can fit a lot better if the scan is good quality. Then all the restorative material and all the orthodontic material will actually fit a lot better and will be a lot more accurate. So this is the Virtuo Vivo from Dental Wings, and there's many out there. This one is probably one of my favorites simply because the wand is so small and it's so fast and it's in color, and it is impressive to the patient. Patients love to see it. They look up. I know it sounds like a silly point, but it is an important point because our patients appreciate technology.
Absolutely.
They know their doctors is up to date on all the technology that we need to look at. One of the other things that we need to look at is, in my world as an orthodontist, most of what I do is aligner treatment, and this is the ClearCorrect, for instance. So if you look at the software, now there's the new software is also coming up, and it's going to be constantly improving. So this is from ClearCorrect. There's a new doctor portal that will be coming out very soon, and I think it's out here in Europe, and it'll be coming up soon. It's an improved prescription. So it's a lot more fluid now to interact with your technician, and it's multilingual. There's many languages in there. Some of the new website, it's mobile friendly. All of us have that little computer in our hand that we call a smartphone. Case submission is a lot easier. It's a simplified 5 steps. So this is not available yet, but it will be available quite soon. And it's friendly for staff delegation. What do I mean by that? In other words, when the doctor is sitting down and working on the treatment plan, the doctor need not to enter the patient's address, the patient's phone number, the date of birth. They don't need to do that. The assistant or whoever works in the office and interacts with the patient can enter all that information, and then once that's done, it's passed over to the dentist, and the dentist can go in and simply focus on the treatment plan, on the clinical aspect of it. And that's quite wonderful. It's going to be easy. It's going to be drag and use. So tooth selection is going to be clickable. So if you need to, for instance, indicate that one tooth is an implant, we can't move it with the aligner. You click on it. It will allow you to do that. So what's coming down the pipeline is certainly very exciting. It's very user-friendly, and it's very intuitive. So it is quite excited. We're working on this, and it will, by the time it's released, people that are using the system will notice a huge difference, and they will certainly appreciate it. It's a well-organized patient page as well. So you have to understand, this is a virtual office for us. So if I'm outside the office, if I'm traveling, if I'm giving lectures, I want to be able to access the patient's file. And this is all will be stored on a HIPAA approved, because we have to take care of privacy. So all of that is private. It's well documented. So I can review the patient's chart quickly and electronically, before I go in, I remind myself of this before going in and modifying the treatment plan. So to me, this is crucial. That's why the information that we enter in there has to be accurate, because ultimately this is our virtual office.
Yep.
This is our virtual world that we work on. There's also the software, the treatment setup software. This is what the technician works with. So you can see it right here. It will be different. It is a little bit color coded. So we can have more attachment choices. Right now, the engagers that we use are sort of limited. They do their job beautifully well, but they will be a little bit more sophisticated, and the setup will be easier for both the technician and the doctor. But this is the software that the treating doctors will see. So it's more, you notice the gingiva is more lifelike, the teeth are more lifelike, and so it's more realistic. And why is that important? Because what we're trying to do is engage the patient. We're trying to motivate the patient. So when you show them this,
showing them,
they'll understand, they can relate to it. So it's an educational tool and it's a diagnostic tool at the same time. So it was very important that we make it lifelike. And again, this is coming very soon. We're just fine-tuning it. Now the next step is the ClearCorrect aligners. For instance, is using one of the aligner system that is out there. It's a low force. There's a new material that is coming out. I'm not supposed to be talking too much about this, but it's the plastic. Yeah, it's a nice preview. The plastic that's coming out is going to be more flexible. It's going to be a little bit more intelligent, if I may say that. So it's going to be a next-gen multi-layer as well, and that is coming out, and the clinical trials are happening in Europe right now. So I'm not going to elaborate too much because I don't want to get in trouble with the company as I talk too much about it, right? Now the Dentigo, and if you haven't seen this, so the Dentigo is from Dental Monitoring, and they're working in close association with Straumann. And this is amazing. This, if you haven't had a chance to see it, go out and see it. It blows your mind. So it is based on artificial intelligence, and what it does, I'm going to go through it. I'm going to take a minute and go through it. In a nutshell, basically, you can capture your smile. Basically, you can share it with your doctor. The doctor will get feedback. We'll take a look at it. There's a software that will tell the doctor, how is the treatment progressing? Is it right on track? Is it off? Where is it off? And then the doctor will send feedback electronically back to the patient. This goes back to the digital ecosystem that we're talking about. You can be traveling, you can be anywhere. All you need is a Wi-Fi connection. Unless you're in the Amazon desert somewhere where there's no Wi-Fi, which hopefully you're not going to be there more than a week. But anywhere in the world, really, there's a Wi-Fi connection. You can communicate with your doctor if you have any questions. Even if treatment is going well and you just need reassurance, then at that point, the doctor can tell you, or the software will be programmed to tell you, it's going well, just switch to your next aligner. So, and the one point I want to mention here is we're talking about customization, right? Because we're not all the same. There's certain people that will need to wear their aligners 3 days, others we need to make them 5 days, 7 days, 10 days, whatever the case may be. This should be determined by the biology. So whether the tooth is moving fast, whether, the biology varies from one patient to the next. Even one stage can vary from between one patient and the next. For instance, I use OrthoPulse in my office. OrthoPulse allows us to increase the biology a little bit more. So in patients like that, I want to switch my aligners every 4 days, for instance. So with this, it will tell us how the aligner is fitting. So, for instance, it will tell you, it will go beyond just the aligner fit. It will tell you gingival recession. It gives you a general idea about the overall health. And it's important to keep that in mind. This is called the Vitals Check from Digital Monitoring, from Dental Monitoring. So the Vital Checks, what it will give you is when a patient scans their teeth, and there's a special gadget that is easy to use, and we'll teach the patient how to use it, and will actually give us an instant report. And that instant report will actually be analyzed, and the patient will get their results. There's almost no human interaction, which is, in a sense, it's good because there's less mistake.
Right.
The interpretation is pretty straightforward, and the patient understands that the artificial intelligence actually gave us these parameters. So it's not like the doctor is trying this or trying that. It's straightforward. 1 + 1 = 2 kind of thing. When you're looking at my smile, and this is amazing because especially the newer generation, they're more visual, right? So with this, with My Smile, you want to be able, once you take a photo with a smartphone or an iPad, you'll be able to see what it looks like with braces, with metal braces, ceramic braces, or aligners. You can simply see what they look like, and then you'll decide, you know what, braces are not bad, I don't want to do that. I doubt people will say that. Most people will choose aligners. I know they will, but it will give the patient an idea of what that looks like. So visually, it's easy to communicate, and it cuts down on words and that hand maneuver that I do as well, right? And it give you, but the other thing that it will do is it will give you a simulation of what the end result will most likely look like, right? And the prediction is pretty good. It's never 100%, but more often than not, it's pretty close. So we'll give you a simulation of what the end results looks like. So what does that do? It'll give the patient a better idea. Is it worth it for me to go through it? But it will also motivate them, because psychologically that patient sees the end result. If they were on the fence, now all of a sudden, yeah, that's what I want. To get there. You're right? So they can relate to it. So it is a psychological decision, but they do relate to it. The last one is the monitoring, and that's straightforward. Basically, what you're doing is when you scan, it will the artificial intelligence will tell us how the aligner is fitting. Is it fitting well within a small percentage of error, obviously, because nothing is 100%. So if it's fitting within a small percentage, then it's fitting well. If something is off, then they get a communication from the doctor, say, wear it a little bit longer, do this, do that, what have you, or you need to come and see us at this point. So now they're free to go in, and they're called in when they're needed. Or again, it could be advised as, hey, why don't you wait an extra couple of days or an extra 5 days? So there's many, many benefits to this, and you still get advice from the doctor and input. So this is absolutely amazing. It will free up the patient, so you can't think of it in terms of time only, but you have to think in terms of efficiency. Absolutely. If we automatically, robotically switch aligners every 10 days, the treatment might go longer than it needs to. So we don't need to do that, because there's certain aligners, like I said earlier, might be 4 days. The same patient, the next aligner might be 10 days, because that movement is a little bit more difficult or a little bit more involved. So ultimately, you end up moving the teeth at the right biological rate, and that's important. So yes, it is time saving, because you don't have to go to the office as often, but it also gives you better results at the end of the day.
And again, sounds like something that enhances the patient experience and acceptance of the treatment.
Technology, I mean, everybody loves technology, right? Especially when this technology is not a gadget. It's actually something that helps with the treatment. And it helps, it opens that two-way communication no matter where you are. It may not be face-to-face, but I'm seeing your teeth, I see what's happening, here's my input, and here's what you need to do, again, no matter where you are in the world, right? So it's amazing. It does enhance the patient experience, and it improves the results at the end of the day.
Fantastic.
Right? And then the last thing is also, as an orthodontist, I practiced as a general dentist for about 6 years before starting my orthodontic practice. So all of that can fit well with the restorative work. So let's say a patient comes in and they have a little bit of space because they lost a molar when they were younger. So now what they need to do is they need to make that space a little bit wider before placing an implant and a crown. So now what we do is, because of this ecosystem, we can plan it all together at the same time. We can place these aligners, we can create the right amount of space, and then once we're done with the aligner, the implants can go in, the crown can go in, and then a retainer is given. So the restorative part becomes part of the full treatment. It becomes a full part of the ecosystem. There's other components that we can fit in here, but as a general system, these are the main components that all of us need. Regardless of the specialty that we practice in, we all need this. So it is quite impressive. All these parts should fit together. It's not complicated. Dentico, when you're looking at Dentico, when you're looking at these scanners, they all, when they're being built, they're built actually to interact with each other, right? Yep. So ultimately, we still need the doctor to navigate it all, to put it together, to interpret it for us, but they fit well together, and that makes the system works beautifully well in this day and age.
Fantastic. It's all very exciting, and it's fantastic to see how the ecosystem really brings, again, an enhancement of the patient experience, but also of the actual outcome and the treatment. So I think that's absolutely wonderful. And it just comes to my mind, you're talking about what's currently available today and what is the digital ecosystem today. But if you could step into the future, and see, okay, what does the future hold for this digital ecosystem? What do you see there?
So these components of these individual components of the digital ecosystem will improve on their own, but collectively they're going to make the system a lot more efficient. And these can only improve. These are only going to get better because that's what we need. We always need to improve on things, and this is human nature, right? And because our patients demand of that
Absolutely.
if there's a better way of doing it, we should do the research, we should work on it, we should improve it. So all these components individually are being improved year after year. As a matter of fact, months after months. So within a short span of time, this is going to get a lot more sophisticated. And when that happens, it's going to become a lot more efficient, right? When we're talking about the future, we used to say future 10 years down the line, 5 years down the line. Today, when we're talking about future, the future is next year.
Now.
The future is in 6 months from now, right? So this is how close the future is. Technology really is dictating everything. The one thing I want to mention is that our curiosity as human beings will always push us to improve, right? And the digital world is no different. So all these components will improve so that collectively the whole organism will get a lot better. So the future is really next door. So we should be grateful. We should be happy. We live in exciting times. And dentistry is getting its fair share of technology nowadays, because for the longest
Absolutely.
time, medicine was improving, dentistry was stagnating. This is the time for dentistry to move forward. It's an evolution and it's a revolution.
Fantastic, and we're extremely excited to be part of that and to look forward to that. And on that note, I'd like to thank you for being with us once again.
Thank you.
Thank our audience at home as well for watching, and make sure to stay tuned for the next session. And that's it from the Straumann Arena of Confidence for now.
Thank you.